Perhaps nothing is more unsettling than feeling inexplicable changes happening in your body, especially when these changes are the harbinger of an unfortunate incident. True, the symptoms of an impending stroke, but don't worry at all, because we have already done a deep analysis of this issue and we are here to guide you in recognizing these signs, a month before a potential stroke occurs. Hello dear friends, welcome to another video of our channel. In this video, we discuss the important symptoms of stroke. So I want you to join us in this video for more and more detailed information about these symptoms. And if this is the first time you have entered this channel, I would appreciate it if you subscribe to the channel. First, I want to explain what a stroke is and how it occurs. A stroke, or a more accurate term, cerebrovascular accidents, is a sudden neurological disorder that occurs due to a blood supply disorder to an area of the brain tissue. In other words, if the blood supply to a part of the brain is disrupted and stopped, that part of the brain can no longer function normally, which is called a stroke. A stroke can occur due to reasons such as blockage or rupture of one of the blood vessels of the brain, which are known as ischemic stroke and hemorrhagic stroke respectively. In ischemic stroke, the blood vessels that supply blood to the brain are closed or narrowed due to a clot or other mass. Due to the reduction of blood fluid in the brain tissues are affected and may be damaged. Also, in a hemorrhagic stroke, blood escapes from one of the blood vessels inside the brain to the environment, which creates a blood attraction. This may put too much pressure on brain tissues and cause damage to brain cells. In general, a stroke is a high-risk situation that requires immediate treatment. But did you know that some of the symptoms of a stroke appear before it happens? Here, we introduce to you 9 stroke symptoms that may appear a month before the occurrence. So stay with us in this video for more and more detailed information about these symptoms. 1. Memory failure. It is usually associated with impaired brain function in terms of memory and learning ability. In the following, we mention some of the characteristics of these symptoms in stroke. Short-term memory loss. People have problems remembering short-term information. They may quickly forget the information they just received. Decreased ability to learn. People may experience a decrease in ability to learn new things compared to before and find it difficult to absorb new information. Inability to remember names. A person may have a problem of not remembering names or information related to people around him. It is important to pay attention to these signs, because memory failure can indicate a violation of communication and a person's normal functioning in everyday life. 2. Severe headache. These symptoms appear suddenly and with high intensity, and usually people who are prone to stroke feel severe and long-lasting pain in a part of their head or head back, which may to begin last a few days or weeks before strokes. 3. Impaired vision. Impaired vision can be one of the symptoms of a stroke. In the following, some of the features of these visual disorders are mentioned. Reduced or loss of vision in one or both eyes. A person may notice that the vision in one or both eyes is suddenly reduced or completely it's gone. Blurred or blurred vision. A person's vision may become blurred, and objects may be seen indistinctly or in dim light. Pressure or pain in one eye. People may experience pain or pressure in one of their eyes. These symptoms indicate that the flow of blood fluid to the brain has been completely or partially stopped or left there. If you experience any of these symptoms and the things mentioned, see a doctor immediately or use emergency services. Well, if the content has been useful and valuable for you so far, please like this video and subscribe to the channel. Be sure to stay with us until the end of the video to know more important signs. 4. Dizziness and unstable balance. In this case, the person may have problems with movement and balance in the month before the stroke, because the brain plays a vital role in controlling movement. Any disturbance in brain function may lead to changes in balance and movement, which are among the characteristics of these symptoms in stroke mentioned below. Sudden dizziness and severe. Dizziness in a stroke may occur suddenly and with high intensity. A person may feel spinning or torque. Unsteady balance or loss of balance. People may become unsteady and have trouble maintaining their balance. These problems may lead to falls. Confusion. In this case, people feel confused or dizzy, which may be accompanied by a feeling of fatigue or the inability to control their movements. To watch the second part of the video, click on the link above.